Chief of Igron's Obstetric Gynecology Clinic and the Department of Obstetric Gynecology in Catholic Medical Center, and is a specialist in HIFU from South Korea.
For 23 years. Now currently most gynecologists think that hysterectomy or myomectomy is a radical treatment until now, but most gynecologists agree this opinion, and as you know, all treatment has advantage and disadvantage. Although not all fibroid to suitable HIFU treatment, but HIFU treatment has very broad therapeutic window. Like myomectomy, we can treat various size, various number, various type, and also combined with case with adenomyosis successfully without general anesthesia and invasive procedure. We can make a complete ablation of a whole lesion, so it can make it possible to treat various difficult cases successfully. I have treated fibroid by HIFU. I prefer HIFU treatment to myomectomy or hysterectomy. Sometimes I think the HIFU is better than myomectomy in many cases. I think HIFU looks like a non-surgical myomectomy. I'd like to share some case with you. Maybe most gynecologists like to do hysterectomy like this case, this following 4 cases. The first case is multiple fibroid. There are more than 20 fibroid I have one session of HIFU treatment of these cases. Treatment time is 84 minutes. After HIFU, about 90% of fibroid was shown in non-perfusion area in enhanced MRI image. And the second case is also multiple fibroid with huge uterus. She had multiple fibroid over 7 cm, 5 cm. Because of multiple fibroid, uterus was enlarged to 14 cm length. I treated over 90% of fibroid. T1 enhanced MRI image shows well-treated state. After 15 months later, 14 cm length of uterus decreased to 7, and all treated myoma was non-enhanced state in enhanced MRI image. Treatment is good treatment modality for this combined case. After 9 months later, the fibroid was disappeared from the uterus, and the uterus size was normalized. Menorrhagia and dysmenorrhea and other symptoms totally disappeared. HIFU can make it possible to a wide range difficult case successfully. This case is diffuse adenomyosis. Adenomyosis about 12 centimeter. She received 3 times in vitro fertilization. Maybe superovulation injection might make adenomyosis worse. I treat near entire lesion by HIFU. After that, the uterine volume was reduced by 87%. HIFU treatment has very good therapeutic effect, including improved symptom, absence of bleeding, short operative time, short recovery time, and good benefit in both short-term and long-term quality of life. This is the process of at our hospital. The diagnostic ultrasound and patient selection and treatment consult was done in outpatient department, and admission about 2 p.m. at treatment day within midnight and pure, and check enhanced MRI and bowel preparation, skin degassing, and the polycatheter insert. HIFU treatment under mild to moderate sedation with pain control. and treatment state. I especially recommend patient dilatation and curettage biopsy for ruling out endometrial cancer and cleaning the endometrial cavity. Sometimes the heavy vaginal bleeding is related to endometrial cancer. Patient discharge before I believe that HIFU is the best non-invasive treatment so far in order to obtain sufficient treatment outcome and satisfaction. We should make accurate patient selection and make sufficient ablation at least over 80% of a whole lesion. Enough experience and the most important to satisfactory treatment outcome. HIFU treatment is excellent in terms of treatment period and return to work and the effect of long-term afterlife. I wish HIFU will be more popular in the future and in the world. I hope my experience I help you. I appreciate your attention. Thank you.